I wanted to welcome everybody today to our webinar. It's Lessons Learned from the DC Water Area Water, Healthcare, and Public Health Workshop. So this was a workshop that was held back in March, and we're sharing some of our favorite lessons learned with you guys today. My name is Quinn McWaters. I work for the Horsley Witten Group. We're an EPA contractor. We work with the Environmental Protection Agency on these webinars. This webinar is sponsored by the EPA. Today we have two wonderful speakers for you guys. We're going to start off with Brendan Sinatro. He oversees the activities designed to elevate the preparedness, response, and recovery capabilities of the DC hospitals through the DC Hospital Association Emergency Management Committee. Brendan is responsible for the grant management of the Hospital Preparedness Program. Brendan also serves as the Preparedness Association liaison for the DC Hospital Association to further support advocacy efforts on behalf of the hospitals and optimize information sharing across DC Health and Medical Coalition stakeholders. And he specializes in grant management, technical assistance, emergency planning, training, and exercise development. So we're glad to have Brendan today. And then our next speaker will be Knox Andres. He is the Administrative Designated Regional Coordinator for the Louisiana Region 7 Healthcare Coalition and Louisiana ESF 8. He also serves as the Assistant Director at the Louisiana Poison Control Center. Mr. Andres facilitates disaster preparedness, response, and recovery for hospitals and health systems in Louisiana's 9 Northwest parishes comprising Louisiana's Region 7. His experience with federal disaster response history includes regional coordination supporting sheltering and hospital evacuations related to Hurricanes Katrina, Rita, Gustav, Ike, Harvey, and Ida. He instructs several medical and emergency preparedness related courses, including the Hospital Incident Command System HAZMAT for healthcare and advanced HAZMAT life support. Mr. Andres also was a co-investigator benchmarking evacuations of 7 hospitals in Texas and Louisiana following Rita. We're very excited for our speakers today,
But first, we will start with some opening remarks from Chrissy Dangle with the US EPA. Chrissy is an environmental and public health scientist with US EPA, currently working for the Water Infrastructure and Cyber Resilience Division of the Office of Groundwater and Drinking Water. Her primary responsibility is leading the public health and healthcare interdependency work, along with promoting the community-based water resiliency outreach for the Water Security Division. Chrissy was also the public health surveillance lead for EPA's Water Security Initiative for 7 years. Chrissy received a Bachelor's of Science in Biology from the University of Dayton and a Master's of Public Health in Environmental Health from St. Louis University. So with that, I'll hand it over to Chrissy to start us off with some opening remarks.
Great. Hello, and thank you everyone for joining the webinar today. Quinn, thank you for all of the introductions and going over kind of the logistics for our webinar for today. As Quinn mentioned, we had a great workshop back in March where we brought together the healthcare systems, healthcare hospitals, and public health entities around the DC area, along with respective water utilities, DC Water in particular. And we had some great guest speakers as well. So we're going to have some of our speakers that we had from the workshop talk today. As Quinn mentioned, both Brendan and Knox have some great information that they would like to share when working with the water utility. So this webinar is meant for all audience, or not just the water utility, not just the healthcare audience, but we want to be able to serve you with information that is helpful for both entities and help you work better together, planning, preparing, and responding to not only water loss incidents, but if there are other incidents outside of water that you all could use to collaborate with together. I am going to put in the chat our division's tools and resources, some of our tools and resources. I'll put the link there, and you can navigate from there to various other tools and resources beyond just the water and healthcare public health sector work. There's numerous items from our division that I encourage folks to check out and see what we have available for you all. And if you ever have any questions for us on behalf of EPA, please feel free to contact us. I'll make sure I have my email address in our general inbox as well. So thank you all again. And the workshop that we had back in March, that's one of many that we've done over the last several years. We've done this series for numerous years now, tackling the water and healthcare public health sector. So we've done these across the United States, and we've learned a lot of lessons learned from small, medium, and large utilities. And there's been some areas that collaborate on a usual basis and others that didn't really know each other's entities before these workshops. So we've learned a lot, and we try to capture those tools, resources, and lessons learned to get those out to folks who are interested. I want to thank you again, and Quinn, I'll turn it back to you. And thank you to our guest speakers again for speaking today.
Awesome. Thanks, Chrissy. And I'm just going to jump right into it. So up next, we have Brendan Sinatra. So Brendan, whenever you are ready, you're up.
Thank you, Quinn, for the intro. Just want to do a sound check.
We got you loud and clear.
Fabulous. And if we could go to the next slide, please. Thank you, Chrissy, for that opening. And again, Quinn, for the opening remarks. Really happy to be here this afternoon. My name is Brendan Sinatra, the Director of Emergency Management with the DC Hospital Association. As was mentioned, you'll see here, we'll talk about the March 6th EPA workshop that we had. The perspective that you'll be getting from me today is that of our hospitals as a member and a cog in the wheel, is, if you will, of the healthcare ecosystem. And certainly, as we talk about and I share with you some of the experiences today, not just from the workshop, but some real world efforts and coordination that's going on as a coalition, you'll get an understanding of where the association fits within that role, where hospitals are, and again, a piece into a larger conversation that is water emergency preparedness. You see here the agenda today. What we'll have is goal and objectives, the intro of the association, as I mentioned, and the response framework to give folks who are joining from other parts of the country an idea of how we manage emergencies and work together in the district and national capital region. It's always important to know where, in terms of hospitals, have their plans established, and some of these come from regulatory requirements, others come from best practice. And we'll talk about as well, most importantly today, and lessons learned from the events, the workshop. I have a top 5 takeaway, and then hopefully time for question and answers. Next slide, please. With the goal today of anything, I hope that you as a participant, and recognizing time is valuable, I hope you can take away one piece of new information, something you can take back to your own respective teams, something to consider in terms of your planning or delivery of a training and exercise. And of course, after this, feel free to use me as a resource. I think at the end of the day as well, network and collaboration is always a positive. Next slide, please. All right, 3 simple objectives. I think it's important, again, as I mentioned, there is a regulatory framework and emergency operations framework and a preparedness mindset, but more importantly, what are we really defining in terms of water emergency? What will we be talking about today from both what we learned from our March 6th exercise and then also some subsequent real world events? And it really helps the association in my role I know where we can apply support and also be a contributor and a stakeholder in our health and medical coalition. The second is the emergency preparedness and response operations. Again, I want to have a better understanding of how they operate in DC, and then again, from the perspective of the hospitals. Lastly, and again, as I'd mentioned, sharing best practices and lessons learned. This is that opportunity. So again, I just want to say thank you to EPA for this opportunity. Shout out to our DC water utility partners who not only for our workshop that we planned, but just the day in and day out collaboration is tremendous. And then also, I did want to thank our local partners, for those on the line from our Maryland and Virginia regional partners, and then also from I know we share Maryland, Virginia, and West Virginia in our end-stage renal disease network 5 for that quality insights group. So to all of you, thank you for participating today. Next slide. Level setting, DCHA, as I'd said, I'm the Director of Emergency Management. We do have a emergency manager work group committee that is a representative from all of our 13 member hospitals. That includes adult and pediatric, specialty, rehabilitation, behavioral health and psychiatric hospital and facility capabilities. And then of course, with our acute care trauma designations. And more importantly, to highlight NCR as well, there are working groups, there are mechanisms which we communicate, whether that they be through the planning and preparedness side or communication networks, whether they be radio data collection systems, and that would be for our Maryland and Virginia partners. So there are layers to this. So with that first layer being DCHA, we convene all of our member hospitals and emergency managers. They really set the tone in terms of the operations and collective goals and problem solving we do together. We then have the second layer. I get into stakeholder engagement, and this is with the DC Health and Medical Coalition. That is the district's healthcare coalition, as guidance through our ASPR HPP program for the Administration for Strategic Preparedness and Response. Now, we as the association serve as a co-partner with our DC Health HEPRA, the Health Emergency Preparedness and Response Administration, that serves as the Emergency Support Function 8, and our planning and operations support for all things related to the HPP program. I've alluded to the NCR, talked about our connections. Again, as a hospital association, my colleagues in Maryland and Virginia are a tremendous resource. And then also from a coalition notification center, both on blue sky and planning side, you can imagine our national special security events, such as inauguration, that does require a level of interstate, interjurisdiction coordination, and we do have the mechanisms to do that. Next slide. When we think about hospital preparedness as it relates to a water emergency, I had talked about, defining that water emergency. We do, and we'll get into some of those specifics, because whether you have low water pressure or a complete outage, if there is a utility disruption, et cetera, that's going to impact the way in which our hospitals operate. We operate as an association, and then of course the Health and Medical Coalition. But to level set here, I do want to cite that for the Center for Medicare and Medicaid Services, we do have regulatory requirements, as well as Joint Commission provides some structures and frameworks from an emergency management and an environment of care perspective. Some of those that I'll highlight is EM 12.2.9, which is essentially criteria 1 through 3, which is the emergency operations planning resources and assets, right? So as you really think about that, you think about our power systems, our water systems, those that are primary to the lifeblood, if you will, of a hospital and this physical infrastructure. So having written plans in place, knowing that you have contingencies when that main primary source of power is then disrupted or removed through an outage, which will be the bulk of this conversation today. We've always alluded to, or at least cited specifically, it is the EM 12.2.9, the 96-hour sustainability plan. And I think that's something that's really tested us as a district and with our hospitals, to really think about how we continue to evaluate what that means, and with a nod to Knox Andrus that you'll hear later from the perspective of Louisiana, and you heard his expertise and experience that he brings to the table, where just looking at how you are assessing your footprint, what are your resource needs, and the best way that you can pre-plan is where you'll be better off. Seeing how regulatory requirements then morph into the actual planning and system function. There are some resources that, Natasha, thank you for providing in the chat, that just also provide not only the general structures and rules, but some of those items that our hospitals use in DC to further refine their emergency operations plans. I want to highlight DCHA and DC Health and Medical Coalition training and exercise as per our ASPR requirements. We do a lot of engagement with our coalition. We work on evacuation, we work on COOP planning, and again, looking at those plans, how we respond to them, not just as hospitals, but as a whole ecosystem in the healthcare and public health space. It also helps us look at what are some of those gaps and challenges. Utility coordination is paramount. We have a great relationship with DC Water, and whether that is through pre-planning or preparedness, we have a utility playbook. We vet that as a critical customer. Our hospitals have the right points of contact and the information to connect, whether it's during business hours. We know emergencies happen 24/7, 365. So knowing who and when to call is really important. So we provide that resource as an association. But then there's the other additional and more important work that is done through identifying what our hazard vulnerabilities are, not just as an individual hospital or healthcare facility, but as a coalition and as a district, and then how that informs the way in which we look at gaps, identify some shared challenges, and solve problems collectively. Next slide, please. And so with all of this collaboration and coordination, and certainly recognizing that we have regulatory requirements, both local and national, recognizing we have a duty for our patients, their families, and more importantly, and equally our staff as well, that all of our plans go through a process of vetting, looking at assumptions and reevaluating if those planning assumptions remain to be true and how they would work in a real-time setting, which lends me to our March 6th opportunity. So it highlights really that number one, identifying stakeholders and fostering partnerships, having opportunities like our March 6th workshop being led by the leadership of EPA and our DC water partners. I think that allowed us to have the forum to have some important conversations. A takeaway for us was being connected with our ESRD network partners, not only to bring them into the fold of the Health and Medical Coalition for alert notification, coordination, and response, but more importantly, there's just a wealth of information that we know. I'll actually highlight more recently, we had an event where their participation, there being the dialysis centers, allowed some of our hospitals and healthcare infection prevention teams to share and vet questions and some curiosities around the availability of services during what would have been a potential utility disruption and outage. Again, fostering partnerships is paramount. Before I go any further, let me just level set though, and I realize that I didn't really talk about the depth and breadth of that workshop. So to give you an idea from what participants at the table, much like today's audiences, we had our hospitals at 50 primary care facilities and health centers. We had 14 intermediate care facilities, including group homes with persons with intellectual development and physical disabilities, 5 ambulatory surgical centers, 24 dialysis centers, pharmacies were represented as well. I think that's important because, again, water disruptions, water emergencies are going to affect a large portion of the community. You'll hear a lot about in the second presentation, not just the healthcare and hospital sector, but that public health framework as well and beyond. Again, focusing on the hospital specific side, we were walked through a series of conversations and presentations, but more importantly, an exercise that said, okay, on a particular day, we are going to walk through the evolution of what we called the big break. And this was fundamentally what began as a low water pressure notification. It then quickly escalated to a significant decrease in water pressure throughout a region that included a hospital. And with that, you had a water main break, which eventually led to potential negative pressure in the distribution system. There were multiple hospitals, healthcare facilities, government facilities, commercial properties, multi and single family residential properties in the area of that main break. And what we were led to do is go through that boil water advisory as it would have rolled out, and looking at, from an alert notification, incident recognition, the mobilization of individual hospital and healthcare system incident management teams, looking at that cohesive work that we would do as a health and medical coalitions led through our ESF8 partners. And again, how would we coordinate with our district? So you can imagine the coordination and communication networking, the importance of public information officer coordination. So we walked through this timeline, and what it really helped us look at, and again, this is from the perspective of DCHA and the hospitals and some opportunities we can take a leadership role on, is looking at, I talked about identifying stakeholders and fostering partnerships, and that goes with some of the examples I highlighted. For resource and asset management, we do an annual critical vendor analysis for water supply. We do differentiate, and I'll get into this in number 3, but what is that depth and breadth and scope of our resources and that need? So really peeling back that onion and saying, okay, now we know in terms of who our suppliers are, or if we have third-party suppliers, but how can we then dig deeper into understanding what their contractual agreements are in the event of an emergency, how they prioritize distribution of resources during an emergency, and how to best coordinate. Again, I had mentioned the utility playbook that we have. Again, it's how can we apply that a concept of an educational resource to our coordination and connection with our vendors and service providers. This workshop allowed us to dive a little bit deeper into that, and has led to what we'll do is a hospital survey specific of equipment, supplies, everything around water, which leads to my third point of words matter. So are we talking about a water disruption? Is that a low pressure event? Is this a complete loss of water to a facility or region or the district? Potable versus not potable water. I think it's really important for non-clinical folks on the line to recognize that we have sterile processing measures with our operating rooms and certain specialized areas of care that do require that water safety and security of that resource. You have the distribution of water for drinking. We do water for waste management. So you can imagine all the important verticals that you have and the cross-sectional coordination you'll need from the hospital when you do respond to those events. The workshop helped us look at, okay, if we are looking at in terms of a boil water advisory and coordination with our hospitals and as a coalition, what exactly are we talking about? So that connection with our utilities and key response agencies to know exactly what kind of emergency we have will then help our hospitals and healthcare footprint respond accordingly. Next slide, please. The number 4 and 5 points, local regional coordination. The concept here is all about looking at how we can best prepare from a data perspective, from a communication and notification perspective. So some highlights here are, one, again, our coordination with our regional partners through our coalition notification network, where we have both Maryland and Virginia patched in with DC through our hospital mutual aid radio system, our EM resource data. I think what that highlights is an opportunity to look at. We have a situation and resource dashboard. A vertical could be water supply, or again, we do recognize that other areas, heating and cooling, steam generation, can be impacted by water emergencies. So we provide data and a dashboard for hospitals to engage us to let them know that a flag's been raised and support's needed. Another highlight you see here, security and law enforcement considerations. This was actually learned from a discussion from that workshop's panel by a hospital that we have, an acute care hospital with the trauma center designation that is both a teaching hospital and connected to a university physically with the same campus. So by having to manage what was the loss of steam and having to get that coordinated when there is also a severe weather event, and that cross jurisdiction coordination of having a large tanker being delivered from point A to point B, just again, from an emergency planning perspective, helps you identify a number of different ways in which a team needs to be prepared and other considerations just beyond getting, power, so to speak, or supply back up to operating function. Infection control, quality and patient safety. I think what's important here, I had referenced in terms of impact to operations based on the type of water emergency you're dealing with. Again, it's going to help know what or who from your facility will be needed to manage and mitigate the emergency or issue. But again, more importantly, as we work with, not just within the hospital community, but our health and medical coalition and district agencies, there are a number of opportunities where not only are we notifying our hospitals, but what type of information from an infection control standpoint can we have pre-batched in a messaging that, again, once we know there is a type of an emergency that's been recognized, whether it be a low pressure, a contamination, or a complete loss of water, we then have in our tool belt, so to speak, just these one-pagers or specific items on mitigation strategies, solutions that hospitals and the healthcare system can employ during an outage or a disruption. I did want to highlight as well for folks on the line, there are resources. Again, thank you. That was my time clock, so just a few minutes left. I did want to highlight, so there is a water management program requirement document through the Joint Commission that is part of our CMMS emergency management rule. But I think what's important here is, again, tying to this number 5 piece that we learned, is that cross collaboration for your environments of care at the hospitals. There are specific requirements for minimizing pathogenic biological events. This would certainly incorporate your infection controls on your facility assessments, mitigation planning, response, communication, et cetera. So keep your eyes peeled in the resources for that, and happy to share any other additional details. Next slide, please. I did mention these are just some other continuous improvement and new opportunities. I cite this because everything can always be reviewed and improved upon, modified to meet the needs of the time. That continues to be our utility playbook and an opportunity for me to keep our hospitals engaged and bring our partners and external stakeholders to the table to share. Looking at regular coordination and stakeholder engagement, this is always something that we're recognizing turnover is happening at our hospitals. How do we equip them with the right information so that they can continue to be effective players, not just for their own incident management teams for their facility, but if we do need to elevate our role across the coalition, district, and national capital region. And again, a lot of these emergencies do require expanded networks just beyond, and of course, before an event happens. I referenced our critical vendor analysis. We are going to continue to work on this. I think the biggest thing is really understanding from a water emergency, what resources are we really trying to look at? I alluded to the 96-hour sustainability plan and business continuity. Those are important, but as DCHA and our members, how can we continue to better understand what the depth and breadth of our capabilities are so that if something does happen, like a boil water advisory for the whole city just before the 4th of July events, as you can imagine, that raised a lot of questions, that raised a lot of opportunities for us to say, okay, how can we leverage data systems that exist to pull information together so that we can respond more effectively and in a coordinated fashion. Resource coordination and response capabilities, that ties into my comments just made a moment ago. Next slide, please. To highlight continued improvement, I would say that looking at the asset and resource inventory, this is going to be a dovetail into our ASPR responsibilities that are required for this next round of 2024-2028 funding. We're going to focus not just as the hospitals, but as a coalition at our resource assessment, looking at our MOU, Memorandum of Understanding, that currently exists between the hospitals. At one point, it included our skilled nursing facilities and extended partners, right? So how can that evolve? And more importantly, look at our resource coordination, when things, emergencies do happen, what are our capabilities? What are those triggers for activation and rules of play, if you will, an opportunity for us to look at those in more depth. Next slide, please. I'll leave it with this. Real world emergencies truly help you dive into your plans, but more importantly, see what does and does not work from a procedure, from a communication node of information exchange, et cetera. So one here, I'll just note that the job action sheets I had referenced, not only did we learn in the EPA water workshop, but in this boil water advisory that, when we knew that we would have a district-wide outage, we didn't know to the duration of time. As we started to think through, okay, what is some catastrophic level planning? What is some worst case scenario concepts? And it was saying, okay, if we are to extend beyond that 72, 96 hour, et cetera, week-long time frame, how do we begin to manage resource requests? How do we look at infection control measures? If there was a need for potential evacuation because we couldn't maintain temperatures, therefore putting patient safety and quality at risk, then all of those do require a series of decision-making, stakeholders at the table. So again, how can we pre-establish whether it's a job action sheet to be disseminated or notification information ahead of time on who and where to call? I'll raise that as a best practice, and we look forward to implementing better concepts of that framework moving forward. The low pressure water advisory, this was at a member hospital. It demonstrated the strength of the association to be able to convene stakeholders. I'll say that was a tremendous highlight. But also when you think about hospital operations, there are a number of folks that are important in mitigating an issue, whether it's facility operations, environment of care, infection prevention, executive level leadership, emergency managers, and clinical operations as well. Making sure that your IMT team is very well informed to your capacity and capabilities and notification structure. Very easily information can be shared in a number of different channels that can sometimes lead to a confusion and again, just in terms of streamlined communication, being able to consolidate that group is critical. And the importance of partnerships, can't emphasize that enough. Next slide. That's it for me. I'm going to hand it over to Knox Andrus. I think what's great, again, He had presented at the workshop and provided a lot of great resources that we're looking at here in the district, not just as a hospital association, but coalition, and look forward to any questions, and I'm available beyond this webinar as well. Appreciate your time. Thank you.
Thank you, Brendan. And just give me 1 second while I pull up Knox's presentation.
All right. Thank you, Brendan, so much for that segue. I appreciate Chrissy, Quinn, and Natasha. Thank you so much for the support and the invitation to be here this afternoon with everybody. I'm, again, very excited to be here and to share with you some of our experiences during our winter storm Uri that we had here in Shreveport, Louisiana. And water is a critical piece of infrastructure for hospitals, for healthcare systems. And so would like to share some of our experiences and some of the things we've learned. So next slide, please. So I am located in Shreveport. My office is within the Louisiana Poison Center. We are the Poison Center for the state of Louisiana. We're located in Caddo Parish. You can see in my purple map, a graphic to the left there where the yellow star is. We're right across the river from Bossier City, which is in Bossier Parish. We're part of Region 7, which is again, the purple area within the state of Louisiana, the graphic to the right. We are one of 9 regions, and we are just about as far away from New Orleans, which is in Region 1, for better or worse, that can possibly experience. So sometimes people ask, where are we relative to New Orleans? So anyhow, this is how we begin to coordinate. Next slide, please. So some more characteristics. We are bordered to the west by Texas, and Arkansas is to our north. We have approximately 500,000 people in Region 7, and Shreveport is the largest city. We have a significant Department of Defense presence here. We have Barksdale Air Force Base, which is the headquarters for the 8th Air Force, located right across the river in Bossier City. We have 31 hospitals in Region 7. We classify them as 17 Tier 1, those hospitals with an emergency department, and then 20 Tier 2 hospitals, which are essentially all other hospitals. We actually came up with that classification process many years ago. It was a way to help plan for triaging resources in a mass casualty or some other disaster, looking at those hospitals that have emergency departments, knowing that in a disaster, we expect to see the surge come to those hospitals first, Tier 1s and Tier 2s. We have one Level 1 trauma center, which is also a burn center and teaching facility. That's Ochsner's Academic Medical Center here in Shreveport. And actually, the Poison Center is affiliated with that facility. Next slide, please. So our organization, so our Region 7 Healthcare Coalition, our HEC, we have many partners, as I imagine most of the coalitions and folks on the line. So it includes hospitals, it includes EMS, it includes emergency management, public health, and obviously the Poison Center. But it also includes many other healthcare partners and types, such as nursing homes and our dialysis networks, our ESRD partners. And we organize in the graph to the right. You can see we have a provider level, we have a regional level, which is where I am, and then we coordinate, especially at the state level, with the Louisiana Department of Health, LDH. Next slide. So when we talk about water hazards and threats, the landscape is really it's quite large, and usually it comes down to a water quality issue. So at some point in time, we're not able to meet water drinking standards in our healthcare facilities. And that may be seen, evidenced by a boil water advisory or order that gets issued. And that's somehow or another related to some contaminant that may be in our water system, be it a city water system, a larger water system, or the water system within the facility itself. And certainly physical and cybersecurity have become of increasing concerns over the recent years. Many times we can see the water hazard or threat as it's related to a mechanical issue. And we know that there's a mechanical issue because we start to experience a low or loss of water pressure in our facilities. And that can come from a municipal water line failure or a facility water failure. It can come from a booster pump issue that's within the facility, or a booster pump that's on the jurisdiction's water network. So there are many different threats and hazards to water systems. Next slide. In Louisiana, we have some other threats or hazards actually that come about from weather issues. And in specific, I'm talking about hurricanes here. Being a Gulf coastal state, we're very mindful of hurricanes. Hurricanes bring historic flooding, tidal surge, winds that result in power losses that all impact our public water systems, it seems, at some point. Hurricane Ida was our last landfalling hurricane here in Louisiana. And you can see that on August the 6th, we had 62 water outages that were reported affecting over 57,000 people. We had 16 community water system outages that had been reported on that date and 231 boil water advisories at that time. And hurricanes are significantly impacting to our water systems here in Louisiana. And then we have from time to time our winter storms, and with the winter storms, the extreme cold component to it that disaffects water main systems, causing breaks and pipe failures, not only within the systems, but also within the facilities. And so most recently, we saw our winter storm Uri in February 2021. Then almost a year later, Christmas time too, we had some Arctic temps that gave us challenges. And then most recently, January 2024, just about a year ago, we had another big winter storm here. Winter storms do pose challenges in Louisiana from time to time. Next slide, please. So if I were to ask a hospital administrator, what is a water emergency for you? And he or she would generally say something along the lines, when there's not enough or the quality of the water no longer meets the patient demands in my hospital or in my patient care environment, then that's a water emergency for me. And so that means I'm looking at problems with not being able to sterilize either surgical or procedure instruments or provide dialysis for those hospitals that provide inpatient dialysis, or my ability to be able to heat the building because of needs for steam, for water for steam production, or for water for the chiller so I can cool the building if it's in the spring or depending on what the summer season might be, or if it's water for consumption purposes, to prepare food and to clean utensils, whether it's being able to provide for toileting and bathing, for laundry, and certainly not least for fire suppression systems that we have in our hospitals or in my hospital. So it may be I need the water for my sprinklers and my fire hydrants. So those are some examples of things that help quantify what a water emergency is. Next slide. So one of the things we've learned here from recent experiences is that we're going to, in an emergency, want to know what the hospital's water PSI is. And so water PSIs, again, help us quantify something about what the water system is like in a facility. And so you can see the graphic on my right where I've got Shreveport hospitals and I've got their normal PSI, and I should have explained that pounds per square inch. What's the water pounds per square inch coming into the hospital? And you can see that some of the PSIs vary a little bit because depending upon the elevation of the hospital and if that hospital has a booster pump and some other things, the normal water PSI can vary a little bit. But in Louisiana, if we have a PSI of 20 or less, then that's an indication that perhaps there needs to be a boil water advisory issued for that water system. And that's going to mean deploying resources. So bottled water, externally resourcing ice. We no longer use ice that's coming from water from that water system. That's going to mean changes for our processes for sterilizing surgical and instruments. And then when the boil water advisory is rescinded, it means we're going to be going back and replacing a lot of water filters. So next slide, please. So now I'm going to talk a little bit about Winter Storm Uri, which was over a time period, February the 12th to the 28th, essentially 10 days in 2021. And if you think about our weather here in Louisiana and in Shreveport, it's normally pleasant weather. We have mild weather. Our average high is 62. Our average low is 41. So it's not a bad place to be usually in Louisiana and in Shreveport. We have measurable snowfall every other year. It's a challenge when things happen. And so you can see a photograph, and this is my drive to work every morning. And so on this particular morning, it was the start of this event, and Kings Highway here is an ice skating rink. And so coming to a stop at that stoplight right there, it can be a challenge. Next slide, please. So the National Weather Service in Shreveport's office gave us this forecast on February the 11th, and they said, hey, the freezing precipitation is getting ready to start, and it's going to be continuing for the next 7 days to some degree. And we think it's going to get really cold starting maybe next Sunday, Monday. And we were moderately comfortable with this forecast. And so anyhow, that kind of rang the bell to start preparing our system. So next slide. So in terms of preparations, we started off with an incident action plan. And so this was a draft incident action plan that was circulated to all the hospitals. And in that action plan, we follow the National Incident Management System requirements of we want to have an incident action plan that addresses and provides objectives, strategies to address those objectives, the resources that are needed possibly to implement those strategies and tactics, and then a suggested assignment for each of those objectives. And so you can see some of the objectives here that we set for our hospitals. When we send out this incident action plan, as we do for regional disasters we see coming, we send out a draft and we ask the hospitals to make it their own, to massage it to something that works for those facilities. Next slide. So this is kind of a graphic overview of the weather and what we experience. And so with that forecast, the National Weather Service was spot on. So on Sunday, the freezing precipitation started to move in and the cold temperatures set in. And it continued for multiple days, you can see here. So it was on February the 16th, Tuesday, around 10:30 p.m. when the first of my hospitals contacted me and said, hey, Knox, we don't have water. And starting about 11 o'clock at night, a survey went out to all the hospitals saying, what's your status? And then what resources do you need? And so we started this process late at night to ascertain what the needs were, then to make those requests to our state agency, Louisiana Governor's Office of Homeland Security and Emergency Preparedness, GOSEP, in Baton Rouge, so that they could start to work to resource the water that we were all requesting here in Shreveport for our hospitals. And so these very cold temperatures, and you can see on February 16th, we had a low temperature of 1 degree, which was a record low for that date. And then we had sub-freezing temperatures for almost 4 days. It was very challenging for not having water. And so it's the acute, urgent need to get water to the city of Shreveport, to the hospitals here initially. And then you can see on February the 23rd, Tuesday, about 7 days later, we had a record high temperature. And all the while we have an unstable water system, and the city and other providers are working to stabilize that system and get it back to a normal point, which actually occurred February the 26th when the boil water advisory was rescinded and the water systems were stable. Next slide. So kind of an overview of the impacts. We had issues with competing resources because we had limited vendors for backup supply. So we had the city of Shreveport was the public water system provider. And so they were, of course, unavailable and trying to make repairs to the system. Most of the ice, there are 2 vendors in the city of Shreveport that provide bulk ice, and both of those water sources are the city of Shreveport. So that meant other ice providers had to be found. We had troubles with access and travel. Once we could find resources and get them here, we had to figure out what is the route of transport for getting them to the hospitals and the facilities that needed them because of the highways, the roads, the bridges that were closed because of the ice and snow. And then we had interruptions to services, and those services were surgery, were dialysis, the kitchen, those areas that I mentioned a little bit earlier. Fire suppression systems were negatively impacted. Sprinkler systems were down, and so fire watches had to be implemented. We had issues with the environment of care, again, with being able to initially heat the building with steam, again, for the lack of water. And then later, when it did heat up, we had at least one facility that had issues with being able to cool their building because they didn't have enough water for chillers. And then we had issues with internal flooding and damage. And as the water system thawed out, pipes began to rupture in different locations, including those in facilities. And so we had flooding issues within some of those facilities. And then in the larger healthcare delivery system, impacted were outpatient dialysis centers and our nursing homes. Next slide. So this is an example of the initial water requests that were made that Tuesday night, early Wednesday morning. We worked quickly to ascertain who needed water, what type of water did you need, potable versus non-potable, what was that quantity, and what was the level of urgency. Maybe we could help triage the resource a little bit. And then, of course, a delivery address, a point of contact, and cell phone number. Next slide, please. We coordinated this through a series of Zoom calls. So every morning at 11 o'clock, the hospitals and partners got on a Zoom call to talk about their status of the facility, the status of the resource request, any other urgent needs that they had. And then we did this again in a systematic process every morning at 11 o'clock. And so that way we kind of kept tabs on how our event was unfolding, and we continued this until the boil water advisory was issued. Was rescinded. Next slide, please. Again, I think I mentioned some of these issues, but of course, being unable to flush the toilet was a large issue. And so you can see bucket brigades were deployed. And this is a photograph from one of the bucket brigades in one of the hospitals. And in a central location in the hospital, bulk water is delivered into large storage containers, these 55-gallon trash cans, if you will. And then from there, buckets are then carried to the units in the hospital that actually need the water so they can flush toilets. We went through a lot of bath in a box like products because again, we need to be able to bathe patients. Certainly hospitals do that on a daily basis, but now you had a much greater need for that product. Surgery was impacted. In some hospitals, boiled water is being carried from the kitchen on the first floor to surgery on the third floor. Surgeons were using bottled water to scrub with. Certainly surgeries were prioritized and elective surgeries were postponed or canceled and then postponed to a later date. In an endoscopy, our automatic sterilizers used city water. And so suddenly that was no longer available. And so a manual, more time-intensive process had to be implemented. Procedures there again were canceled or postponed and then rescheduled. In dialysis in our hospitals, initially there wasn't enough water PSI to run the reverse osmosis machines, and dialysis had to be rescheduled and resourced in different facilities that still had capability across the river in Bossier City. We had one hospital that used a special dialysis process and they didn't have enough dialysate for their machine. And actually we had significant challenges being able to find that dialysate. So next slide. Operation issues, I think I mentioned this. We had initial challenges with heating our buildings because of the needs to generate enough steam for some of those buildings. Again, on the 8th day, when we hit that 79, Ochsner LSU, their chillers were challenged by that water supply deficit. Suddenly we were initially responding to, hey, we don't have enough heat, to now we don't have enough cooling capability. So we pulled together truckloads of fans, spot coolers to support those areas that needed them in the hospital. Then down in the kitchen, kitchens were having to boil water so they could clean the very necessary utensils that they were having to use. And sometimes they were again boiling water for the surgical instrument sterilization process. And as you can imagine, kitchens went through an incredible amount of disposable plates, cups, and utensils. Again, everybody was looking for the same resources. And then, of course, ice machines and drinking fountains, they had to be turned off, the bottled water deployed, and eventually these devices were all returned to normal, flushed, and filters replaced when the boil water advisory was rescinded. Next slide, please. Logistical issues. Again, getting the water to get to the hospitals was a challenge in itself because the snow and the ice that we are not used to dealing with too much here in Louisiana created tremendous travel hazards. You see this bulk water truck in the photograph. If you look at its left rear tire, you can see it's completely come off the rim. And I think that's pieces of it are lying there in the road. But this is what was happening, trying to get bulk water into Shreveport because most of it was coming from out of state. We had some that was coming from the south, but a lot of water was coming across from Mississippi or was coming over from Texas. And so, the roads were incredibly challenging. Another challenge we had was that our water fill station was initially inaccessible because you had to go over a really tall hill. And again, snow and ice made it challenging to get to the water fill station there. And then once the water tankers arrive, they need some other things. They need pumps and hoses and connections to be able to connect to the hospital to get that water in the hospital. And so there were times when the pumps and the connections that were sent did not marry up with the hospital. And so we had to work around that. The fire department was the one that helped us put that all together. Again, fire departments are huge resources in a water outage. Next slide, please. So talking about dialysis, we have or had approximately 1,778 outpatient dialysis patients in Caddo Parish based on Empower data from January 2021. And so we have a significant dialysis population. And these folks live their lives having to go to an outpatient dialysis center for scheduled dialysis, usually every other day. And so it's very important to them that allows them to have a life that keeps them out of the hospital. But if they're unable to be dialyzed, then they can become an acute patient in the ER. And so it's a terrible, challenging thing for the dialysis centers. And so all 13 of our Shreveport dialysis centers were impacted by this water loss. And we went through a similar process as we're going through with our hospitals. We worked on ascertaining what their needs were, what their status was, and then getting those water supplies moved to those outpatient dialysis centers. Initially, we were able to identify 3 centers that we could stand up and operate 24/7, and then build out the other dialysis centers and get them back online as we were able to get the bulk water transported to those facilities as well. And so we had a 4 o'clock we had a 4 o'clock dialysis call every day to go through the same, what is your status? What is the resource status that's been deployed there? And where are you with coming back online? And we did that again until the bulk water advisory was rescinded. Next slide, please. When this event was over, of course, we had an after action as part of our recovery process. And so one of the things we did was to come up with a checklist for hospital and healthcare facility water outages. And so you can see some of the bullet points here relative to our findings in our after action. And we put this together and we published it. It's now found on the Louisiana Hospital Association website. And that's a link there that's in the slide. And I'll work on getting a hard copy of this, or I'll share a copy of this with Quinn at the conclusion of this webinar today. Anyhow, one of the important things that we found or that I appreciated is, having an emergency contract with a vendor that can support a water outage. So it's going to be important that you think about how can you get water, potable water, ideally, to your hospital in times of need. And also to think about, can you have a water well at your facility that perhaps, if it can't support potable water needs for different reasons, then perhaps it can be used to support non-potable water needs that you might have. And then work with your fire department and make sure they understand your water situation in case you actually have to deploy these resources and you need the assistance of the fire department in making the connections that you might need. Anyhow, next slide. With that event that we had in February 2021, we got to do this again. So just last year in January, and we had a similar forecast from the National Weather Service saying, hey, you've got this blast of very cold air coming, and it's going to bring some winter precipitation with you. So here we go again. Next slide, please. So this is kind of summary of what happened. It was very similar to the previous event. The freezing precip started on Sunday. It was followed by approximately 3 days of sub-freezing temperatures, which are really hard on our water systems. It was Wednesday when Shreveport Hospital started reporting, hey, we have no water, or we have a significantly decreased water pressure, and the city of Shreveport water system initiated a boil water advisory. And so we went for almost 3 days, again, with an unstable water system before the boil water advisory was rescinded after the 64 samples were collected and tested. Again, similar situations before. Next slide. So we did similar preparation. So we shared communications relative to what the weather service briefings were, We circulated our incident action plan again. We circulated our emergency water checklist again, just to refresh people's memories about, hey, we've been down this road before, not too long ago. We shared our Empower data relative to our vulnerable populations in our community. And so with that, we circulated our shelter and warming station details, our hours of operation and points of contact at our shelters and our warming stations in the area. We also went to work with our dialysis network again and established points of contact with all of our networks and to make sure that we had phone numbers that we could easily access those POCs for any potential needs we had. And then finally, as a kind of a little reminder, we actually had a list of Louisiana State water support contractors. And so we put those out as well. Next slide, please. We started our same process with regional coordination with Zoom calls. So we had our daily 11 o'clock calls with hospitals, our 4 o'clock calls with our dialysis partners. But something that was new that we added this time around that we didn't do in 2021 was we made sure that the City of Shreveport Water Department was included on our calls. So we started each of our calls with a briefing from the water department so they could share where they were in the response. And so that was very important addition, I think, to our call. Next slide, please. And so our hospital response was very similar as before. Plans were enacted. The boil water advisory protocols were initiated, but this time we deployed new water resources. The hospitals went into action with it. So you can see some examples. So in the photograph to your right, you can see the hospital that now has 3, I believe they're 12,000 gallon poly tanks, and they're part of their water system now within that hospital. And so they've provided this additional reservoir of potable water that this hospital always has. Now, at some point in time, if there was a complete water failure, at some point in time, a vendor or someone's going to have to come back and refill those tanks, but they have a buffer that's going to carry them over for a substantial number of hours there at that hospital. Or if you look at the far left-hand photograph, you can see the tanker that the water tanker that is pulled up to the hospital that now has a 5,000 gallon water bladder. And so this hospital's purchased a water bladder. It went to a local rental store and rented the pump that it needed, the green pump you see in the photograph there. And it's connected to the water hauler, the vendor that's actually trucked in the water. And so he's able to come in and fill up that water bladder and then keep that hospital operating sufficiently for the duration of this water outage. And then you see the photograph in the middle of your slide. And at this particular hospital, they actually had 2 different hospitals here in Shreveport. They pre-staged 8 water tankers before the water outages actually occurred. And so you have 1 water tanker that's at the facility offloading water. The other tanker is making the run to the water source and filling up, and it's a constant round robin of truck water tanker movement. And so was able to keep these hospitals functioning. And then we have other hospitals that deployed additional resources to keep them up and running. And so the good news in this particular case, there were no requests that were made to the state for water support during this outage because these hospitals had become essentially self-sufficient with the resources and the planning they put in place. And I think that was a great success story. One of the things that we did learn, though, is that you will have other people and other industries, other nonprofits that will be going to the same water fill stations to fill up their tankers with water. And plans need to be in place to prioritize hospital and healthcare facilities being able to get to the water source, because again, there'll be a lot of competing people going to fill up their water tankers. So that takes a bit of coordination. Next slide, please. And again, after this January 2024 water outage, we got back into recovery mode after the water advisory was rescinded, resources were demobilized. We got together to talk about the takeaways in the after action. And the final takeaway was we need to go back and make sure everyone's on board with our emergency water planning supply checklist. And it's linked there below. And I think that's all I got. Next slide. Thank you.
Thank you, Knox. I know you were pushing it there at the end with the timing, and I know we're a little bit over, you guys. Thank you again, Knox. Thank you to both of our speakers. I'm going to pull up one last slide to wrap us up today. I do sincerely apologize. We do not have time for questions at this time, but if you would like to, please enter those in chat, and we will capture that chat. And that way we can get back to you with more information from our speakers and make sure that we get all that information out to you guys. So again, I just wanted to thank you guys today. I'm going to share, just like I said, one last slide, and it's just to let you guys know that you will be receiving an attendance certificate today. If that helps you with any continuing education credits, we will get that to you via email within 2 weeks. And this webinar was recorded, so that recording will be made available as well. So again, thank you everybody for sticking around. It was a great webinar, and please keep entering those questions in chat and we'll capture those. But enjoy the rest of your day, and thanks again for being here, and thanks to our speakers. Have a good one, everyone.
Thank you. Stay safe. Be well.
Thank you.